close your eyes for a moment. Imagine the intricate network of systems that keep your body humming. Your heart beats, your lungs expand and contract, your digestive system churns. This intricate orchestra is coordinated by our nervous system, a complex web of communication. Imagine this nervous system as a vast electrical grid, with the brain as the central power station. Electrical impulses race along this grid, carrying vital information. 12 pairs of cranial nerves emerge directly from the brain, connecting with our head, face, and torso. Each pair has a distinct role defining how we experience and interact with the world. Some control eye movements, allowing us to marvel at a sunset. Others carry the sense of smell from a freshly brewed cup of coffee. Still others govern our ability to taste, hear, and feel the world around us. Join us as we unravel the mysteries of these hidden pathways and appreciate the symphony of the human body. Our senses are the windows to our world, allowing us to experience the richness and complexity of our surroundings. Imagine biting into a ripe strawberry, the sweet juice bursting on your tongue, or listening to the soothing melody of your favorite song. These sensations are made possible by the intricate workings of our cranial nerves. They carry sensory experiences to our brains where they are interpreted. Among the 12 cranial nerves, several collect and transmit sensory information. The olfactory nerve carries the sense of smell, from baking bread to a rose's perfume. The optic nerve transmits light signals, creating the images we see. Imagine the sight of a starlit sky or vibrant flowers. The auditory and vestibular nerves bring us sound and balance. Imagine the joy of music or maintaining balance. The trigeminal nerve handles sensations in our face, head, and mouth. Imagine a cool breeze on your cheek or the taste of salty ocean air. These nerves create a remarkable symphony of senses within us. To appreciate cranial nerves, visualize them as a network originating from the brain. They branch out to innervate designated areas. This mapping ensures efficient signal transmission for seamless communication. The brainstem is the central hub for most cranial nerves. Some nerves, like olfactory and optic, originate from the cerebrum. Imagine tracing the facial nerve from the brainstem to facial muscles. This network allows us to express emotions through facial movements. The vagus nerve travels from the brainstem to vital organs. It regulates heart rate, breathing, and digestion. While the cranial nerves work tirelessly behind the scenes, ensuring the smooth functioning of our bodies, sometimes things can go wrong. Diseases, injuries, or developmental disorders can disrupt the delicate balance of these nerves, leading to a range of conditions that can impact our quality of life. Imagine waking up one morning and realizing you've lost your sense of smell. This seemingly simple deficit, known as anosmia, can be caused by damage to the olfactory nerve. Anosmia can have a profound impact on our enjoyment of food, our ability to detect danger, and even our social interactions. In other cases, damage to a cranial nerve can have more debilitating consequences. Bell's palsy, for example, affects the facial nerve, causing paralysis or weakness of the muscles on one side of the face. This can lead to drooping of the eyelid and mouth, difficulty speaking, and problems eating and drinking. While Bell's palsy is often temporary, it can be a distressing and disfiguring condition, highlighting the importance of early diagnosis and treatment. The study of cranial nerve disorders is a fascinating and complex field, offering insights into the intricate workings of the brain and the delicate balance of our nervous system. By understanding the causes, symptoms, and treatments for these conditions, we can strive to improve the lives of those affected and develop new therapies to address these often challenging disorders. In the following sections, we will delve deeper into the world of cranial nerve pathologies, exploring specific conditions associated with each nerve and the impact they have on patients' lives. Imagine the delicate scent of a rose, its velvety petals unfurling in the morning sun. This remarkable feat of sensory perception is orchestrated by the cranial nerves, the brain's direct messengers. These nerves also command muscles to move with precision and purpose. Motor functions of cranial nerves are crucial to our daily lives. The oculomotor nerve, or CN3, controls most of the muscles that move our eyes. Picture yourself reading a book or watching a tennis match, your eyes darting back and forth. It also controls the muscles that constrict our pupils, adjusting light entry. Imagine stepping into bright sunlight, your pupils instinctively constricting to protect your eyes. As we delve deeper into the realm of motor functions, we encounter another key player, the trochlear nerve, or CN4. This nerve, named for the pulley-like structure through which it passes, controls a single muscle responsible for downward and inward eye movement. Imagine yourself gazing down at your feet as you walk or glancing at the tip of your nose. These subtle but essential movements are made possible by the trochlear nerve. Working in concert with the oculomotor nerve, the trochlear nerve ensures smooth and coordinated eye movements, allowing us to track objects with precision and maintain our balance as we navigate the world around us. Imagine yourself walking on a narrow beam, your eyes constantly adjusting to maintain your equilibrium, or following a bird in flight, your gaze effortlessly tracking its every move. These feats of coordination highlight the intricate interplay between these two vital nerves. Next, we encounter the abducens nerve, or CN6, responsible for controlling the lateral rectus muscle, which moves the eye outward. Imagine gazing at a distant horizon, your eyes widening to take in the panoramic view, or glancing sideways at a passing car. These movements, essential for expanding our field of vision and maintaining spatial awareness, are all made possible by the abducens nerve. The coordinated action of the oculomotor, trochlear, and abducens nerves ensures that our eyes move smoothly and efficiently, allowing us to explore the visual world with remarkable precision. These nerves, working in perfect harmony, highlight the elegance and efficiency of the human body's design. Moving beyond eye movements, we encounter the trigeminal nerve, or CNV, a true multitasker. Known for its sensory functions, it also controls muscles involved in chewing and biting. Imagine sinking your teeth into a crisp apple, feeling the crunch as your jaw muscles work. The trigeminal nerve innervates the masseter, temporalis, and pterygoid muscles, the powerhouses of mastication. These muscles generate the force needed to tear, grind, and crush food. It also controls muscles involved in swallowing and speaking. The trigeminal nerve helps shape the sounds we produce, contributing to our speech. Our journey through the motor functions of the cranial nerves leads us next to the facial nerve, also known as cranial nerve 7. It's a fitting name for a nerve that plays such a crucial role in our facial expressions. This remarkable nerve innervates the muscles responsible for a wide range of expressions. Imagine the myriad emotions we convey through our facial expressions: joy, sadness, anger, surprise, disgust. The facial nerve's influence extends beyond our outward expressions. It also plays a role in controlling the muscles involved in closing our eyelids. Imagine blinking reflexively to clear away a speck of dust, or squinting in bright sunlight. And when we shed tears, the facial nerve is there, controlling the muscles that squeeze tears from our lacrimal glands. These tears are essential for lubricating and cleansing our eyes. Furthermore, the facial nerve plays a crucial role in our sense of taste. It innervates the taste buds on the anterior two-thirds of the tongue. Imagine the symphony of flavors we experience with every bite. Continuing our exploration, we encounter a nerve that often goes unnoticed, but plays a vital role in our everyday lives. The vestibulocochlear nerve, also known as cranial nerve 8. While primarily known for its sensory functions, transmitting auditory and balance information from the inner ear to the brain, the vestibulocochlear nerve also possesses a subtle motor component. This motor function involves controlling the stapedius muscle, a tiny muscle located in the middle ear. The stapedius muscle, innervated by the vestibulocochlear nerve, helps to protect our hearing by dampening the vibrations of the stapes, one of the tiny bones in the middle ear that transmits sound waves from the eardrum to the inner ear. Imagine attending a loud concert or standing near a roaring jet engine. The stapedius muscle contracts reflexively, reducing the intensity of sound waves reaching the inner ear and protecting our delicate hearing mechanisms from damage. This protective reflex, known as the acoustic reflex, is triggered by loud sounds and helps to prevent noise-induced hearing loss. While often subtle and unnoticed, this motor function of the vestibulocochlear nerve plays a crucial role in preserving our hearing over a lifetime of exposure to various sounds, from the gentle rustle of leaves to the thunderous roar of a waterfall. The vestibulocochlear nerve, with its dual sensory and motor functions, exemplifies the intricate interplay between these two aspects of our nervous system, working in concert to ensure our perception of and response to the world around us. Moving further down the brainstem, we encounter the glossopharyngeal nerve, also known as cranial nerve 9, another nerve with both sensory and motor functions. This nerve plays a crucial role in swallowing, controlling the muscles that lift and widen the pharynx, the passageway that connects the mouth and nose to the esophagus and larynx. Imagine swallowing a mouthful of food or taking a sip of water. The glossopharyngeal nerve springs into action, coordinating the muscles that propel the food or liquid down the pharynx and into the esophagus, ensuring it reaches the stomach for digestion. This seemingly simple act, repeated countless times each day, relies on the precise timing and coordination of muscles controlled by the glossopharyngeal nerve. But the glossopharyngeal nerve's motor functions extend beyond swallowing. It also innervates the stylopharyngeus muscle, which helps to elevate the larynx during swallowing and speaking. This elevation of the larynx plays a crucial role in preventing food from entering the trachea, the airway that leads to the lungs, and ensures that air is directed to the vocal cords for speech production. The glossopharyngeal nerve, through its control of these muscles, ensures the safe passage of food and air through the pharynx, allowing us to nourish our bodies and communicate with the world around us. It's a testament to the intricate design of our nervous system, where seemingly simple actions like swallowing involve a complex interplay of muscles and nerves working in perfect harmony. Imagine yourself walking through a field of lavender, the air thick with its sweet, calming aroma. Or picture the comforting smell of freshly baked bread wafting from a bakery, beckoning you inside. These olfactory experiences, so evocative and intertwined with our memories and emotions, are made possible by the remarkable sensory capabilities of the olfactory nerve, also known as cranial nerve 1. The olfactory nerve is unique among the cranial nerves in that it is purely sensory, dedicated solely to the perception of smell. Its journey begins in the olfactory epithelium, a small patch of tissue high up in the nasal cavity where specialized olfactory receptor cells lie in wait, ready to capture and interpret the language of scent. These receptor cells are exquisitely sensitive, each one tuned to detect specific odor molecules that float through the air we breathe. When these molecules bind to their corresponding receptors, they trigger a cascade of electrical signals that travel along the olfactory nerve fibers, bundled together like threads in a tapestry, towards the brain. These signals, carrying the essence of a rose, the richness of coffee, or the tang of the ocean air, journey through tiny openings in the skull, bypassing the blood-brain barrier, and arrive at the olfactory bulb, a small bulb-shaped structure located at the base of the brain. Here, the signals are processed and relayed to other parts of the brain where they are interpreted as distinct smells, evoking memories, emotions, and even influencing our behaviors. Consider the awe-inspiring sight of a starlit sky, the intricate details of a painting, or the reassuring smile of a loved one. These experiences are made possible by the optic nerve. The optic nerve transmits visual information from the eyes to the brain. In the retina, rods and cones capture light and convert it into electrical signals. These signals travel through the optic nerve to the brain, where they are interpreted as images. Imagine the joy of listening to your favorite music, the rhythm and melody washing over you, or the comforting sound of rain drumming on a rooftop. These auditory experiences, so integral to our emotional lives and our ability to communicate, are made possible by the intricate workings of the vestibulocochlear nerve, also known as cranial nerve 8. The vestibulocochlear nerve, also known as the auditory vestibular nerve, is a dual-purpose nerve, responsible for both hearing and balance. Its auditory component, the cochlear nerve, arises from the cochlea, a spiral-shaped structure in the inner ear that resembles a snail shell. Within the fluid-filled chambers of the cochlea lie thousands of tiny hair cells, the true receptors of sound. These hair cells are exquisitely sensitive to vibrations, swaying in response to sound waves that enter the ear and travel through the fluid. As these hair cells dance to the music of our surroundings, they convert the mechanical energy of sound waves into electrical signals. These signals travel along the cochlear nerve fibers, bundled together like delicate wires towards the brainstem. From the brainstem, the auditory signals journey to the thalamus, the brain's sensory relay center, and then onto the auditory cortex, located in the temporal lobe of the brain. Here, the signals are interpreted as distinct sounds, allowing us to perceive the nuances of speech, the beauty of music, and the cacophony of the world around us. Section 4. The face of sensation. Imagine the feeling of a cool breeze on your cheek, the warmth of the sun on your face, or the sharp sting of a paper cut. These sensations are made possible by the trigeminal nerve, the fifth cranial nerve, the largest of the cranial nerves. It has three main branches: ophthalmic, maxillary, and mandibular, responsible for sensations in the face, scalp, teeth, and mucous membranes. The trigeminal nerve provides us with a constant stream of information about the world in contact with our faces. A taste of life. Think of the sweet, juicy burst of a ripe strawberry, the salty tang of a potato chip, or the bitter bite of dark chocolate. These taste experiences are made possible by sensory nerves, including the facial and glossopharyngeal nerves. These signals journey to the brain, allowing us to savor flavors and experience the pleasure of a satisfying meal. Section 6. The wandering guardian. Imagine a nerve so extensive that it reaches from the brainstem all the way down to the abdomen. The vagus nerve, the 10th cranial nerve, regulates heart rate, breathing, digestion, and immune response. It carries both sensory and motor information. Sensory fibers monitor blood pressure and heart rate, sending information to the brain. In the digestive system, it signals fullness and regulates digestion. The vagus nerve is a silent guardian, maintaining our body's balance. Imagine waking up one morning and realizing that the world seems strangely muted. The aroma of freshly brewed coffee, once so invigorating, is barely perceptible. The delicate perfume of a blooming flower fails to register. This loss of smell, known as anosmia, can be disorienting and isolating. Anosmia can result from viral infections, head trauma, or aging. Imagine the impact on a chef, a perfumer, a sommelier. The loss of this crucial sense can be professionally devastating, but the impact of anosmia extends far beyond the professional realm. Imagine the simple pleasures denied, the joy of smelling freshly baked bread, the comforting aroma of a loved one's perfume, the evocative scent of rain on dry earth. These everyday experiences become distant memories. Anosmia can be a symptom of a serious condition like a tumor or Parkinson's. Seek medical attention if you experience a sudden loss of smell. Early diagnosis and treatment may help restore the lost sense of smell. Sight, our most dominant sense, allows us to navigate the world and connect with others. But what happens when this vital sense is compromised? Disorders affecting the optic nerve can lead to visual impairments, from blurry vision to blindness. Optic neuritis, an inflammation of the optic nerve, can cause sudden vision loss, often in one eye. Imagine waking up to find your vision blurred or dimmed, as if looking through a fogged-up window. This alarming symptom, often with pain during eye movements, can be the first sign of optic neuritis. While the exact cause is unknown, it is often associated with autoimmune diseases like multiple sclerosis. Other causes include viral infections, certain medications, and nutritional deficiencies. Treatment typically involves corticosteroids to reduce inflammation. Most people experience significant improvement within weeks or months, though some may have lingering visual impairments. Another serious condition is glaucoma, a group of eye diseases that damage the optic nerve, often due to increased eye pressure. Imagine this pressure as a slow, silent thief, gradually stealing your peripheral vision. Without proper treatment, glaucoma can lead to irreversible blindness. Early detection and treatment are crucial to preserving vision. Regular eye exams, especially for those at increased risk, are essential for early diagnosis and intervention. Our sense of hearing, orchestrated by the vestibulocochlear nerve, connects us to the world of sound. Disorders affecting this nerve can lead to hearing loss, tinnitus, and vertigo. Hearing loss can result from damage to the cochlea, the auditory nerve, or the brain regions responsible for processing sound. Imagine struggling to follow a conversation in a crowded room or not hearing a warning signal in a dangerous situation. Tinnitus, a ringing or buzzing sound, can interfere with sleep and concentration. While the exact cause is unknown, it is often associated with hearing loss or exposure to loud noises. Vertigo, a sensation of spinning, arises from problems with the vestibular system in the inner ear. Imagine the disorientation of feeling like the room is spinning and the fear of falling. Disorders affecting the vestibulocochlear nerve can significantly impact our quality of life. Early diagnosis and treatment are essential to managing these conditions. Section 4. The face betrayed. The face, a canvas for our emotions, allows us to express feelings through movements controlled by the facial nerve. Disorders affecting this nerve can cause facial paralysis or weakness, leading to difficulties with speaking, eating, and even closing the eyes. Bell's palsy causes sudden weakness or paralysis of the muscles on one side of the face. Imagine waking up and finding that you can't smile or frown on one side of your face. While the exact cause is unknown, it is thought to be triggered by a viral infection. Most people with Bell's palsy experience a full recovery within a few weeks or months. However, in some cases, it can be a symptom of a more serious condition, such as a tumor or Lyme disease. Therefore, it's crucial to seek medical attention if you experience sudden facial weakness or paralysis. Treatment depends on the underlying cause and severity of the symptoms. Corticosteroids may be prescribed to reduce inflammation, while antiviral medications may be used if a viral infection is suspected. Physical therapy may be recommended to help strengthen the facial muscles. Section 5, a silent tongue, a muted world. The ability to speak is a gift often taken for granted. Disorders affecting the glossopharyngeal and hypoglossal nerves can lead to difficulties with swallowing, speaking, and even breathing. Dysphagia, a swallowing disorder, can arise from damage to the glossopharyngeal nerve. Imagine the fear of choking every time you swallow or the frustration of not being able to eat your favorite foods. Dysarthria, a speech disorder, can result from damage to the hypoglossal nerve. Imagine the frustration of struggling to find the right words or the embarrassment of not being able to express yourself clearly. These difficulties can significantly impact a person's quality of life. Early diagnosis and treatment are crucial to managing these conditions. Section 6. The vagus nerve, a symphony disrupted. The vagus nerve, cranial nerve 10, plays a crucial role in regulating bodily functions. Disorders affecting this nerve can lead to a range of symptoms. Gastroparesis can occur when vagus nerve damage disrupts the normal contractions of the stomach muscles. Imagine feeling constantly full after eating only a small amount of food. Vasovagal syncope, a sudden drop in blood pressure and heart rate, can be triggered by vagus nerve overactivity. Imagine the fear of suddenly losing consciousness. Dysautonomia can involve vagus nerve dysfunction, leading to symptoms like dizziness, fatigue, and digestive problems. Disorders affecting the vagus nerve can be challenging to diagnose and treat. A multidisciplinary approach is often required. Understanding the role of this nerve is essential for developing effective therapies. The bustling hospital ward hummed with the quiet murmur of worried families and the rhythmic beeping of medical equipment. Dr. Anya Patel, a neurologist known for her sharp intellect and compassionate touch, made her way through the organized chaos. It contained the details of Mr. Edward Davis, a retired librarian in his late 60s with perplexing symptoms. His ordeal began with a nagging cough and persistent hoarseness. Then came digestive issues and difficulty swallowing. As Dr. Patel reviewed his history, a pattern emerged, hinting at a deeper disturbance. Dr. Patel entered Mr. Davis's room, her warm smile a stark contrast to the sterile environment. He sat propped up in bed, a book of poetry lying open on his lap. Dr. Patel listened attentively as Mr. Davis recounted his symptoms. "It's like a part of me is fading," he confessed. "The world seems quieter, the smells less vivid." Dr. Patel's mind raced, piecing together the puzzle of Mr. Davis's condition. The combination of symptoms suggested a disruption in the function of multiple cranial nerves. Dr. Patel's examination revealed a pattern of sensory loss on the left side of Mr. Davis's face, suggesting involvement of the trigeminal nerve, responsible for facial sensation. She also noted a slight drooping of his left eyelid and mouth, a subtle but telltale sign of facial nerve weakness. These findings, combined with his vocal cord paralysis, pointed to a potential lesion, a region of damage or disruption, somewhere along the pathway of these cranial nerves. To pinpoint the location and extent of the lesion, Dr. Patel ordered a series of imaging studies, including an MRI of Mr. Davis's brain and brainstem. As she examined the scans, a small, shadowy mass came into focus, nestled near the base of his skull, pressing gently against the brainstem where several cranial nerves originate. "It appears to be a schwannoma," Dr. Patel explained to Mr. Davis and his wife, who sat beside his bed, their hands clasped tightly together. "It's a slow-growing, usually benign tumor that arises from the Schwann cells, which form the protective covering around nerve fibers." Relief washed over Mr. Davis's wife's face, but he remained stoic, absorbing the weight of the diagnosis. He had a tumor, a foreign entity growing silently within the confines of his skull, disrupting the delicate circuitry of his nervous system. It was a daunting realization, yet there was a glimmer of hope. Schwannomas are often treatable, and with early intervention, the damage caused by the tumor can often be reversed. Dr. Patel outlined the treatment options for Mr. Davis, explaining that surgery to remove the tumor was the most definitive approach, offering the best chance of preserving his remaining nerve function and preventing further neurological decline. However, surgery carried its own risks, including potential damage to surrounding nerves and blood vessels. Mr. Davis, ever the pragmatist, weighed his options carefully. He understood the risks of surgery, but he also recognized the progressive nature of his condition and the potential for further deterioration if the tumor was left untreated. After careful consideration and discussions with his wife and medical team, he made the courageous decision to proceed with surgery. The surgery was long and delicate, requiring the expertise of a skilled neurosurgeon who carefully navigated the intricate anatomy of the brainstem, gently teasing apart the tumor from the surrounding cranial nerves. As the hours stretched on, Mr. Davis's wife waited anxiously in the waiting room, her thoughts a whirlwind of hope and fear. Finally, the surgeon emerged, a weary but satisfied smile on his face. "The surgery went well," he assured her. "We were able to remove the entire tumor, and we're optimistic about Mr. Davis's recovery." Mr. Davis's recovery was slow and gradual, marked by small victories and setbacks along the way. The surgery had been successful in removing the tumor, but the delicate cranial nerves, compressed for so long, had suffered some degree of damage. Speech therapy became an integral part of his routine, his voice regaining strength and clarity with each passing session, like a forgotten instrument being patiently brought back to life. His swallowing difficulties, too, gradually improved with the help of a speech therapist, who taught him exercises to strengthen the muscles involved in swallowing. He approached these exercises with the same quiet determination that had characterized his life, finding solace in the small triumphs. A sip of water without choking, a bite of food that went down smoothly. The world, once muted and distant, slowly began to regain its vibrancy. The aroma of his wife's cooking, the chirping of birds outside his window, the comforting sound of his grandchildren's laughter. These everyday sensations, once taken for granted, now held a renewed intensity, a reminder of the preciousness of his senses. Yet the experience had left an indelible mark on Mr. Davis's outlook on life. He had faced his mortality, confronted the fragility of his own body, and emerged from the ordeal with a profound appreciation for the intricate workings of his nervous system, the silent orchestra that had faltered but ultimately endured. Section 2. The Fragile Threads of Connection. Mr. Davis's story serves as a poignant reminder of the vital role cranial nerves play in our daily lives. These 12 pairs of nerves, often hidden from view and rarely given a second thought, are the invisible messengers that connect our brains to the world around us, enabling us to perceive, interact with, and experience the richness of human existence. They carry the symphony of sound to our ears, allowing us to appreciate music, language, and the comforting rhythm of nature. They transmit the kaleidoscope of light to our brains, painting the world in vibrant colors and intricate details. They allow us to taste the sweet, sour, salty, bitter, and savory flavors of our food, adding another dimension to our enjoyment of life's simple pleasures. They give us the power of speech, the ability to articulate our thoughts, emotions, and ideas, forging connections with others through the spoken word. They govern our facial expressions, allowing us to communicate non-verbally, conveying a universe of emotions through a smile, a frown, a raised eyebrow. And silently, tirelessly, they regulate a myriad of bodily functions, keeping our hearts beating, our lungs expanding, and our digestive systems humming along, often without our conscious awareness. Section 3. A Symphony Restored. As we've journeyed through the intricate world of cranial nerves, exploring their functions, innovations, and the disorders that can disrupt their delicate balance, we've gained a deeper appreciation for the complexity and resilience of the human nervous system. We've seen how damage to a single nerve can have a profound impact on a person's life, robbing them of their senses, their mobility, or their ability to communicate. We've also witnessed the remarkable capacity for healing and adaptation that exists within the nervous system, as individuals like Mr. Davis navigate the challenges of recovery and rediscover the joys of a world re-engaged. The study of cranial nerves is not merely an academic pursuit confined to the pages of medical textbooks. It is a journey into the essence of what makes us human, a quest to understand the biological underpinnings of our perceptions, actions, and interactions with the world around us. Section 4. The Enduring Marvel of the Cranial Nerves. The cranial nerves, though often unseen and unappreciated, are a testament to the enduring marvel of evolution. A testament to the intricate design of the human body where form and function are intertwined in a delicate and awe-inspiring dance. Their story is a reminder that even the most complex functions, from the seemingly simple act of smelling a rose to the intricate process of composing a symphony, rely on the precise orchestration of countless biological processes, all coordinated by the silent symphony of our nervous system. As we delve deeper into the mysteries of the brain and the nervous system, we continue to unlock new secrets about these remarkable pathways, gaining a greater understanding of their role in health and disease, and paving the way for new treatments and therapies that can improve the lives of countless individuals affected by neurological disorders. Section 5. A call to further exploration. But our journey doesn't end here. The world of cranial nerves, like the vast universe itself, is ripe for further exploration. Each nerve, with its unique pathway, function, and vulnerabilities, holds new secrets waiting to be uncovered, new insights into the human experience waiting to be revealed. For those intrigued by the intricacies of the human body, for those drawn to the mysteries of the brain, for those who marvel at the resilience of the human spirit, the study of cranial nerves offers a lifetime of discovery. So let us continue to explore, to question, to marvel at the wonders of our own biology, and to celebrate the enduring legacy of these 12 cranial nerves, the silent guardians of our senses, our movements, and our very connection to the world around us.